Hi everyone, my name is Nurse Ange-Aimee, and today I wanted to talk to you about the benefits of working in home health nursing. I have been a home health nurse for about 3 years, and it was a little rocky in the beginning. So really I just want to offer some tips first, and then also talk about the pay and the benefits. So some of the tips that we're going to go over is finding a company that cares about the patient, finding a company that values you as a nurse, work-life balance, not taking on more than what you can handle, charting on time, and then also knowing when to ask for help. So those are some of the tips, and then lastly, we'll talk about the pay. Okay, so first, finding a company that cares about the patients. This is very important. There are a lot of different companies out there that don't care about the patient's safety. They really just care about the money. So you really have to do your research on these companies. So one of the first ways you can do that is by Googling the company, looking at the reviews. If they have a low rating, you definitely want to stay away from them. If they have a higher rating, you can read like what patients are saying about the company, what people that work for the company are saying. This is very important, probably the most important thing to begin with, because your license is on the line when you're working for these companies. So 2, working for a company that values you as a nurse. So I've worked for a couple different companies that I had to stop working for because they just didn't value, like they kind of talk to you like you're not even human, like you just don't matter. Nurses are people too. We have families, we have emergencies, we have to worry about our safety, especially home health nursing. We're going into patients' homes by ourselves. There's so many different things, and you have to work for a company that is going to support you in every aspect. So that's a big one. If you are working for a company and you just feel like they do not care about you at all, you have every right to, put in your notice that you will not be working for them anymore. Okay, and then the next we're going to talk about work-life balance and not taking on more than what you can handle at the same time. So basically, I love working home health because it's very flexible. I have 3 children. I have a 7-year-old, a 5-year-old, and a 2-year-old. And I feel that I can easily see my patients and give them everything they need, and also have the energy to spend time with my kids and my family at home. So this is the main thing, but I had to learn the hard way, learning how many patients I could take on a day and then still have time to pick up my kids or do whatever else I need to do. You need to really time it the right way. So typically for me now, a visit takes about 45 minutes, but in the beginning it might take you 2 hours because you don't really know what you're doing yet. So you just need to factor that in until you get comfortable. And also you might go to a patient's house and expect to be there for 45 minutes, and then something happens and you're there a lot longer. So you need to factor that in when you schedule your patients. So if you need to pick up your kids, you need to have at least that hour time frame between the last patient, so that way you're not feeling stressed. And then also when you schedule your patients, you need to give them an hour gap, like I said, because you don't know if the previous patient can take longer. So as of right now, it does take me 45 minutes to see patients, and I haven't had to have like a long visit lately. And that's because also I call ahead and I'm trying to make sure I know exactly what the patient needs and what I'm getting myself into. That kind of also ties back to making sure you work for a good company that's going to give you the H&P and all the details that you need to know about this patient before you go to the patient. I have worked for companies where, I'll give you an example, a patient had a PICC line. I had no idea they had a PICC line, wasn't in any of the documentation, and family's like, okay, what are you gonna do? So you really wanna make sure you're prepared when you go. So when you're calling to schedule, you wanna ask, hey, do you have any open wounds? Do you have a PICC line? What's, all of these different details. So another thing is charting. Some companies, based off what system they use, you might be able to get some of your charting done while in the house. That's one thing I love, because instead of, for instance, writing your vitals down and then having to come back home and put them in, you could just put them in right then and there. And then also kind of write a little bit of your narrative right while you're there. Another thing is, while you're in the patient's house asking questions, it's easier to make sure you're hitting all the questions if you're able to chart in the house. There are some systems where you're not able to chart in the patient's home. Also, knowing when to ask for help. So being that you work in home health, sometimes it does feel like you're alone. A good company should have a case manager who should be able to answer questions. So say you get to the patient's house and you don't know what to do, instead of doing something that could potentially put the patient at risk, you want to stop right there and call the company and say, hey, you know, I wasn't aware that this patient had this going on. I need help. What should I do? Also, you know, if it's just something that you cannot handle, you need to be honest and just let the company know, like, I did not know that this patient had this. I'm going to stop right here, and we'll go from there. And they'll have to send another nurse out that knows how to handle that particular thing. Also, as a home health nurse, you have every right to call the ER. I mean, we don't, one of the things I think to myself is I don't have an ER in my car. So if I get to the patient's house and I don't have what I need to save their life, I am going to call the ER and wait for them. That's a whole nother story, but you have to know in those moments, okay, this patient needs help. Just because they're at home doesn't always necessarily mean that they're stable. So you need to know when to call someone for help, and basically go from there. Another video, I can give you a little bit more details and more examples. Lastly, I guess I'll just talk to you guys more about the benefits and the pay. So to start, my advice would be to work per diem for multiple companies. Per diem, you typically get paid by the visit. There are some companies that will pay you by the hour. Here's a little tip. You get paid more per diem versus per hour, and it's more flexibility per diem. And you can work for as many different companies as you want for per diem. So per diem home health visits are typically for the admission, between $120 and $200. I have worked for a company that paid the higher end, $200. So just so you know. And the recertification visits are typically $100. And then the discharge visits are typically $100. Of course, the admission visits are going to take you the longest. This is where you're going to be signing consent forms, doing a full assessment, writing down all medications, and seeing what services that your patient needs. So that's why you get paid a bit more for those. And then the recertifications are the visits where you're seeing if the patient is still needing home health services. Those are a little easier because you already know the patient. You're just more so looking up the medications, making sure those are the same, writing down any differences. Discharge, of course, if the patient no longer needs home health, or sometimes they make the decision that they don't want it anymore, you're just going to discharge them. So those are the different visits. So as the RN, you'll typically be doing admissions, research, and discharge, and the LVNs will be the ones to follow up. After you do the admissions, you send the reports to the case manager, and then the case manager works on what the patient needs, such as physical therapy, LVN visits, how many LVN visits, do they have a wound? If they do have a wound, this is something that I've always questioned, you know, so sometimes some companies expect the RN to write the wound order. You know, I'm gonna say that for another video because yeah, I'm just gonna say that for another video. So if they have a wound, you do wanna make sure that you have at least the basic supplies. And then you also wanna take pictures of the wound during the admission process. Outside of that, if they're just like need medication management or something like that, you just basically do the admission and see what the patient needs. Let's see what else. I mean, that is pretty much the basics. And I guess I'll tell you a little bit why. Okay, and then also this is my first video. This is my first video, so I would like some feedback, any questions that you may have about it, what I could work on. If you could please let me know. And I'm actually just gonna stop the video here because I feel like we went over a good amount. Later I'll kind of talk to you about charting and any other questions you may have about it. But I do want to say I love it. I love the one-on-one time with the patients. I love getting to know their families. I love the flexibility. I love the pay. I just love every aspect of home health. I don't see myself going anywhere else right now. I'm just really satisfied with where I am. It did take me a while to finally get to this point, a lot of trial and error, but I love it. So please ask any questions, and I will see you guys next time. Bye.